Hello everyone, I'm drberkkkaratas. I will talk about tibial nerve stimulation for the treatment of premature ejaculation. Now, what is the tibial nerve? How is it done? What it does, how effective it is. We will discuss all of these one by one. Now, as I mentioned earlier, there are two treatment methods for premature ejaculation. One is behavioral therapy. We have a program related to ejaculation control. You know, our op.dr.berk program, there are medications that are used continuously, creams, sprays, etc. And now, we also have a treatment plan related to the new Tibial nerve stimulation. Now, from the guide published by the European Measurement Standards, so like the Constitution, in our thing here regarding medications like spray creams and some psychological treatments, because this issue can also have a psychological and social infrastructure. After talking about this, he discusses behavioral therapies, and here he mentions transcutaneous posterior tibial stimulation. I've been following this for a long time. Actually, so where will the study go? How will it be? Will they plan a new study? That's it. And we have started implementing it for a while now. He is referring to study number 844. That study is this study, a study conducted by the Boston Health Group from Columbia. Now here, of course, these are, in fact, they were so successful in the study. They immediately planned the second study. They are about to publish the results of that study. With medication, that is the one that delays premature ejaculation the most, to be more precise. They are comparing it with paroxetine, one of the most effective medications that delays premature ejaculation by 3 to 8 times. I'm also eagerly waiting for the results. Now let's get back to our study. In this study, here's how it goes. For 12 weeks, there are 3 sessions per week, each lasting about 30 minutes, so each session lasts 30 minutes. A total of 90 minutes of tibial nerve stimulation was done in 1 week. What is the tibial nerve? Where is it? I'll explain it shortly. That's it. At the beginning, the average ejaculation time of these 12 patients was 32.4 seconds. 6. After 90 weeks, it's 156, look, 48. A week and 24. It's significantly increased in a week. Ejaculation times have increased. Now, the thing we call the tibial nerve is this. It starts from the feet, from the foot. It starts from here and goes up. And then it joins a larger nerve. From there, it goes to the pelvic block. Of course, there's something about this. When you stimulate this area, you are directly stimulating the nerves in the pelvic region. This has a physiology. It has both a physiological and a logical infrastructure. They explain it clearly like this. In the scientific study, I'm not going to explain this because it's very hard to understand, but generally speaking, if you say that you stimulate this nerve by stimulating the pudendal and hypogastric nerves, it says you can delay the sensation of ejaculation and postpone ejaculation. They have such physiological and anatomical explanations. Yes, this nerve starts just below our foot. From here, we have a bone here called the malleus, the inner side of our foot. It passes through there. You simply place 2 props. And this happens here 3 times in 3 days, every other day. Almost, you are stimulating, that's the situation. So what are the success results of these 12 patients? The average increase in the number of times is 4.82. So from the start until it ends, the patients are 4.82 times delayed. They have ejaculated. One of the 12 patients has already dropped out of the study. The other 6, let's say 6 out of 11. They were very happy. Now what I said from there are other graphs as well. The happiness rate, in fact, they were very satisfied, they were happy, but almost all of them, look, it's 12 times. So it has increased this much. So actually, if it takes 30 seconds to ejaculate here, it's 60. What happens? He ejaculated in 70 seconds. It means it has increased by 2.5 times. Look, almost all of them have shown an increase. But this is the face that brings smiles. We can say that these smiling faces are very happy with this work. So the success rate can be said to be around 60% on average. Now I took these directly because these writings are important. Here they say that the people conducting the study claim that it increased by an average of 4.8 times. In medications, this rate is between 3 and 8 times, and they say it's about 4 to 5 times there too. So he says it has almost the same effect as the medication. He says this treatment we did, and at the same time it continues. He says that medications have a lot of side effects. When medication is used, it can cause nausea, vomiting, and so on. But this, it has no side effects. That's why this situation definitely needs to be evaluated, he says. We need to work more. They themselves have a lot more things. They have planned a comparative study with medication and are continuing it. So how are we doing this? If you say, I want to start this treatment, then you need to evaluate whether you are suitable for it. Why? It's not a treatment suitable for everyone after all. For example, it was referred to as secondary. In the second year, early ejaculation start. It's not applicable. So, for example, you've been married for 6 years or you have a partner for 6 years. You have had premature ejaculation for the last year. This also needs to be researched further. This treatment is not suitable. Let's assume that we've determined you are suitable. How do we do it? Now, I usually provide training for 100 faces in a session at the clinic. What am I doing? I'm explaining the physiology of ejaculation. Now, this won't work without understanding the logic behind it. Actually, we do this in the ejaculation control program as well. We're doing pelvic muscle training. We're doing and teaching breathing muscle exercise training. And we're providing device training. We give patients the device for 12 weeks so that not everyone just picks it up and uses random silly devices. With the Kiralama method, we're teaching them the things they need to do. It goes here, IT goes here. It's learned very easily. Everyone learns very easily. In one session, after 12 weeks, they bring the device back to us, and when they do, we already conduct an evaluation. How's it going? That's why, especially behavioral therapy is very important in young people. I mean in young people, because ejaculation is a controllable situation. It's very important to exhibit the right behaviors. But after a certain age, you know, they have 2 kids, they've reached 45 or 50 years old. This behavior is 12, week 13. For those who won't be able to dedicate time to this, if they don't want to start with medication, then we can really try this tibial nerve stimulation. The stimulation can be tried. In the patients I've tried, there was an increase of about 3 to 4 times. Quite a few patients, really very happy. But let's say if you're young, single, or you don't have a steady relationship, or if you're newly married, nerve stimulation along with behavioral therapy will be quite beneficial. As a result, I've been recommending tibial nerve stimulation to my patients for a while now, and I'm doing it. This means I've been waiting until now. I wanted to get results from my own patients because it's all about acceptance. The studies are good, so the acceptance study is good. It's continuing at the same time in other studies, but I wanted to see it for myself. You know, I saw that it was helpful, so I thought I'd explain it this way. As a result, for premature ejaculation, there are behavioral therapies, medications, pills, creams, etc. Thirdly, tibial nerve stimulation can also be done. Thank you